Good morning. I'm pleased to open the workshop to lay the foundation or the landscape for what's occurred prior to this workshop in the area of the science of credentialing in nursing. So first of all, my task is really to describe the state, but as the presentation unfolds, what I plan to do is begin by framing credentialing in terms of some national priorities to which they align, and then discuss some of the work that's been done prior to the Standing Committee on Credentialing Research in Nursing by the American Nurse Credentialing Center Research Council, and some of the evidence that was summarized through the council and some papers by Vicki Lundmark. And then talk a little bit about what we learned that brought us here from our work through the IOM Standing Committee on Credentialing Research in Nursing. So we'll talk a little bit about the state of the science as it is today and introduce some of the methodological issues that unfortunately abound in the research that we've reviewed, and talk a little bit about the current state of the science. So to start, this issue of credentialing research in nursing is not a problem looking for a policy. It is a problem that aligns well with some of the major initiatives and problems that we encounter nationwide in America. Just two in particular that I'd like to highlight. Number one being the recent report that was published in 2014, which is the 2013 National Healthcare Quality Report by Agency for Healthcare Research and Quality, and the second being the Institute of Medicine report, that Future of Nursing Leading Change in Advancing Health. So in the first case, Agency for Healthcare Research and Quality report, the news is not all good in terms of the quality nationwide. In a summary of all the quality metrics that are collected by Agency for Healthcare Research and Quality, the issue of quality itself is fair at best, with about 70% of the population receiving the care that they actually should. Now, that's good news, that's up, but still 70% is not our aspired standard. There still continues to be large variations in care across where you live and who you are, although it's getting better. Access to care is also struggling. About 26% have difficulty getting the care they need. So that issue of access has actually gotten a little bit worse in the last year's quality report. And disparities actually are poor. There's no change in disparities, with minorities and people in poverty experiencing more disparities or worse care. So in framing it in terms of quality of care, here's a problem that nursing can actually affect. That's a nationwide issue and priority. The second report was the Institute of Medicine report published in 2011, The Future of Nursing, and there are two specific recommendations that affect our work today. First, nurses should practice to the full extent of their education and training, and second, nurses should be full partners with physicians and other healthcare professionals in redesigning the care in the United States. So here's where credentialing comes in. So there are a number of ways that credentialing can help. Credentialing can help by standardizing and validating specific skills that are needed, knowledge and competencies that are needed to improve the quality of care and benefit the patients that we serve. To fulfill these partnership initiatives, nurses will need to achieve advanced leadership skills to be able to lead and identify problems, lead in the improvement of the problems, and translating the evidence to practice for specific populations in need so that they receive the care they expect and they deserve. So those two areas in particular, I think, are important for us to consider, because this issue of credentialing is not in isolation. It's really framed within how do we as a profession provide the care that patients expect and deserve, and credentialing may be one of the answers. So the issue of credentialing research in nursing becomes very important within that framework. So just to set a common definition for all of us, this is a definition from the International Council of Nurses, and you can read it with me. Credentialing is a term applied to a process used to designate that an individual, program, institution, or product have met established standards set by an agent, governmental or non-governmental, recognizes as qualified to carry out this task. The standards may be minimal and mandatory or above minimal and voluntary. So just highlight the statement that standards may be minimal and mandatory or above minimum and voluntary, because much of the conversation in credentialing research is the latter, actually. It's minimal and voluntary. The benefit of credentialing, and this again comes from the International Council on Nurses, is threefold. First of all, credentialing protects the public. It provides some professional accountability, and it also improves or assures the quality of practices and services. And why? Why would that be true? So first of all, credentialing establishes expectations for quality practice. So when credentialed practices are held to the credential standards, it motivates the provider to make improvements and changes in practice where necessary. Second of all, credentialing standardizes the practice across settings. So standardization is one of the mechanisms that improves quality of care. So the less variation when evidence-based practices are used, the better the overall quality. Third, it serves as an evaluation tool for practice competency. So individuals and organizations that seek credentialing not only meet a standard, but they're also motivated to continue to meet the continuing standards as they evolve and improve and the bar is raised. For example, if we are credentialed as a oncology, in the oncology specialty, one of the requirements is that we continued with our continuing education so that we can demonstrate those skills, competencies, and knowledge needed for oncology nursing, for example. So let me just move now to discuss individual credentialing so we can see some of the scope of individual credentialing that we've discussed in the ANCC Research Council and then the Standing Committee on Credentialing Research and Nursing, and that we'll face today in some of our discussion. So there are typically three types of credentialing. The first is that initial licensure of an entry-level nurse. So these are the basic skills that are required. Now these nurses are of course licensed by the state board. We've not spent much time talking about this kind of credentialing. The second, however, is when that nurse has a certification for specialized skills or training within the scope of their basic professional licensure. In this area, seems that it's one of the areas where we can best meet some of those demands and quality gaps through this specialized certification and skills that we can provide to special populations. And then the third type being licensure for advanced practice nursing. We've also spent less time talking about advanced practice nursing, and that's nurse practitioners, certified nurse midwives, clinical nurse specialists, and certified registered nurse anesthetists. They, of course, are licensed by the state for their entry into practice. So as I said, most of the discussion today in terms of individual credentialing relates to this second category, those that are licensed and achieved a specialty kind of certification in a specific area. The second type of credentialing that we'll summarize is that of organizational credentialing. So I know you're familiar with magnet recognition program, and American Nurses Credentialing Center also has a second type of organizational credentialing, and that's Pathway to Excellence. So we'll cover some of that evidence related to magnet credentialing today from the organizational aspect. So let me step back. Much of what I say comes from not only my opinion, but work that's been done in the past. There are two papers that are already publicly available that have summarized some of the evidence related to individual and organizational credentialing. And I just want to acknowledge Vicki Lundmark, who's the Director of Credentialing Research at American Nurses Credentialing Center, who has published a synthesis in 2008 and again in 2010 with Joanne Hickey, who at the time was the chair of the ANCC Research Council. And in follow-up, Joanne Hickey resigned from the chair position and then was followed by Dr. Karen Haller, who led this second portion of the national agenda for credentialing research in nursing. So the Research Council was charged with synthesizing the evidence and understanding what is known about credentialing research in nursing. So not only did the Research Council work toward this aim, but they also conducted a summit bringing in outside facilitators to try to conceptualize the relationship of the variables and to understand the state of the science in credentialing research. And as I mentioned, there are 2 papers preceded that, and that's the work of Vicki Lundmark. And since that time, these 2 papers have been published, and that was 2012, a white paper on the national agenda for credentialing research in nursing, primary author Vicki Lundmark once again, and then another paper published in Nursing Outlook with the primary author Joanne Hickey in 2014 to summarize some of this work if you're interested in some of the background. So in the 2012 report, the ANCC Research Council summarized the evidence and proposed an initial conceptual framework that framed the variables that would be important to us in credentialing research. At that time, around 2012, the American Nurses Credentialing Center worked with the IOM to launch the standing committee at the Institute of Medicine to consider these frameworks, the evidence, the challenges, and to expand the discussion from within nursing to interprofessional discussion. Meetings were held between 2013 and 2014. There were 4 meetings. Some of the work that I'll summarize were primarily from 2 presenters at one of the first meetings. So what that work did is it opened an interdisciplinary forum to discuss the state of the science, examine the impact of credentialing on nurse, patient, and organizational outcomes. It evaluated some of the designs and methods that are being used in nurse credentialing. It opened a dialogue among people and multiple organizations. And we heard from not only organizations, but employers, policymakers, interdisciplinary colleagues involved in credentialing already, and funders. So it broadened the conversation about what we know in credentialing research at that time. So the model for credentialing research, and I'll have to say that this model is one that was parsimonious. So if you can imagine the complex variables that affect an intent to be credentialed and the intervening variables that can modify or mediate credentialing in their relationship to outcomes were pretty diverse. But I have to say, some of the drawings looked a little bit like a porcupine with lots of spikes and lots of relationships. So what the council came to agreement on was a parsimonious model, knowing that it's not specified at the level that we need. The 2 major constructs in these models are standards and credentials. So we've already defined credentials, individual and organizational credentials, but in terms of standards, standards are those authoritative statements that that are defined and promoted by the profession. They include a desire to improve quality of practice, service, and education. And it also allows us a metric on which to evaluate our practice and outcomes. So standards and credentials, you can see, are the major constructs that have a dynamic relationship. Standards affect credentials, and the credentials, in fact, affect standards. And then standards and credentials also have a dynamic relationship with a number of intervening variables. So the intervening variables can relate to contextual variables like work context, structures that are within the organization that enable our impede a nurse's ability to provide care. And then those intervening variables have a direct link to the outcome. So this is a theorized relationship. And the idea was at least to frame what we had learned to this point, and then provide some additional material or theory for us to further specify this model, which you'll hear more about today from Jack Needleman. So in terms of the state of the science, at the end of that exercise, I just highlighted the summary of the state of the science at that time. And although it is hypothesized that credentialing leads to higher quality of care, more uniform practice, and better patient outcomes, the research evidence to validate these views is limited. And so, unfortunately, there's a lot more that needs to be done, which is why we're here. Let me move now to the first meeting on the Standing Committee on Credentialing Research in Nursing. I mentioned between 2013 and 2014, 4 meetings were held that preceded this workshop. The first evidence summary I'd like to refer you to, and I provide a link, is that of Dr. Meg Johansson. And the second is the organizational literature that was summarized by Dr. Linda Aiken. So in terms of the state of the science for the individual, unfortunately, it's scant. So this is the summary that Dr. Johansson provided, and you can see not only is it scant, but the direction of the relationships is not consistent. So most of the studies are descriptive, correlational. They are relationship focused as opposed to comparative research. They're small. They use a small number of variables. Unfortunately, this work is pretty complex and hard to measure everything one needs to measure. Several studies have certainly focused on topics such as the value of certifications. Others have focused on knowledge of certification. But that, in terms of the relationship to patient outcomes, is actually summarized here. And attempting that link to patient outcomes has been difficult at best. So that's another thing we'll hear more about today, are some of these methodological challenges related to this secondary data use and observational studies that become challenges and opportunities for us. The second source of evidence was that of organizational credentialing that was summarized by Dr. Linda Aiken. Most of us are very familiar with this literature base. And she reported that in magnet environments, in terms of magnet recognition or magnet accreditation or certification and nurse outcomes, the evidence was positive, but not all studies were positive. That's in terms of work environment, lower turnover, and better nurse work environment, and intent to leave. In terms of nurse outcomes, there was less evidence, but evolving evidence. But once again, the predominance of research related to nurse outcomes was related to mortality, failure to rescue, and nosocomial infections. And of course, we've seen some additional evidence. So once again, we have a evolving, robust body of evidence with some studies citing positive and some studies citing negative findings in terms of outcomes. But once again, the high prevalence of observational studies, both survey and secondary data that are relational and not comparative, came up again as a problem. The issues around operational and conceptual clarity and definition and interpretation of the variables came up as an issue. And the third was the inability to attribute the outcomes to a single nurse becomes very difficult as well. So I am just going to pause there to conclude the comments. And I would say this: have you ever walked by something and you said, what is that? I don't understand it, you know? why would somebody put this here? I was with a friend in a hotel in Atlanta, and I saw this, and I had to stop. And she turned to me right away, and she said, well, it's a bird dog. Okay? So I stepped back, and she was exactly right. And I would say the first picture is where we are right now in credentialing research. We look at it, we don't understand, we don't know what it means, we don't know what the relationships are, but it's evolving, and it's really, really important. It's important because healthcare in America is a priority for us, and credentialing is one of the answers to fixing or to solving some of the stickiest problems that we encounter. But unless we have a good research base, both in terms of individual credentialing and organizational credentialing, it will be understudied and underutilized. So today is a really important day for us to come together and really struggle with some of these conceptual problems and methodological problems so we can step back and we can have clarity in exactly what this is and the value we can bring to the people that we serve. And I'll have to give you the end site of this. So this actually is a wonderful statue by an author by the name of Mary Engel. And she often does these media related to animals or dogs. And if you look at this, you can see that it's created by multiple media, and it's just full of small birds. So if you look closely, you know it's a bird dog. So I look forward to adding clarity together at the end of the day. I look forward to wrestling with some of these common issues that we face in the methods that we use and to making recommendations about how we can solve these common problems in science together. Thank you.
I think Robin did a very nice job in, I think, sharing with you some of the challenges that the Standing Committee faced when we began our task last year in terms of thinking about research and the science, state of the science for credentialing research in nursing. For the rest of the next 2 days, we're going to be taking you with us as we share some of the work that the Standing Committee has been thinking about in terms of what Robin's laid out. So before we have the next speaker, I just wanted to briefly turn to our planning committee and our standing committee members to see if there are any clarifying questions for Robin before we move on. Or our sponsors. Any clarifying questions from any of our sponsors? Well, I guess that was clear enough, huh? Before I introduce you to Dr. Jack Needleman, I just want to briefly sort of frame how we're going to do the Q&A. So after each presenter, we'll do a Q&A, and this is the way we're going to do it because there are a lot of you in the room, and hopefully many of you have comments or questions. So after each presentation, I'll be doing the same thing. I'll take questions first from our planning committee, then our standing committee, our sponsors, and then we're going to open it up to the rest of you. For those of you in the audience who have questions and you think of questions during the talk, if you could collect a card. Who has the cards? They're all in the, okay, you'll see the cards. Jot it down for us. That will help us organize your questions and get to as many of them as we can. So I'll be looking for those cards from you. Okay. Yeah, when you have a question, hold it up and we'll collect those from you. Okay, Dr. Jack Needleman. Dr. Needleman is a professor of health policy and management at the University of California at LA Fielding School of Public Health. He just told me he is the new chair of his department. He is also a member of the planning committee for the Credentialing Research on Nursing. He is also a member of the standing committee on Credentialing Research in Nursing. And I think you will very much enjoy him drilling down into the framework